We're still seeing a rapid increase in cases. We all have over 37,000 cases reported, and this morning we got an additional 1,000. So we're averaging anywhere from 400 to 500, and on some days 1,000 new cases. So we are definitely seeing the surge. We're also hearing from people who, gathered together over the Thanksgiving, and they're telling us that multiple members of the family are coming up with positive tests. So we are seeing the surge from the Thanksgiving gatherings.
That's really unfortunate to hear. And can you just give me a sense or paint the picture of how different it is now compared to how it was in our last peak?
We have actually exceeded the numbers that we had in our last peak. And the concern also is how rapidly the numbers are increasing. Right now, our hospitals are getting to capacity. They still have some capacity, but at the rate we're going, I think there is some concern that by the middle of December, we will be at that tipping point.
Okay, and that's just a couple weeks away.
That's correct, yes.
All right, well, let's talk about the optimistic side of things, which is, this vaccine. I guess, you can talk if we know about locally. That'd be good if we can only refer to kind of what California's telling us now. I guess that's fine too, but to hear it from somebody who really knows is kind of my objective here. So what do we know about vaccine? Let me say that again. What do we know about vaccine rollout plans right now?
We know that it's expected to start in December, probably either mid or end of December. The initial doses will be a little over 300,000 for California. So the goal is to start with vaccinating people in the healthcare industry. So especially those that are providing direct care to sick people. And so we have a list of the individuals in our databases, and we are communicating with the hospitals to make sure that we will be ready to start that vaccination.
And you just made me think, do we have a sense of here how it's going to break down?
We do, but we still need additional detail because right now we don't know how much Sacramento will get. We don't know how many doses we will get. And that will determine how many people will be involved. We might need to, in addition to looking at the whole list of healthcare workers, is to decide a priority even within that priority group who we would start with. The good news is that the expectation is that the other doses will start rolling in within a few weeks. So it's not like we're going to have to wait a month before we're able to vaccinate anymore, but definitely we need to know who we will start with, and that's why we are communicating with the hospitals so that they can help us in identifying those individuals.
And if you can't, this is fine, but can you give me a sense of who the priorities are within the priority group? Who are the most important people in these equations?
It would mainly be especially those that are providing direct patient care, because they're the ones that are at most risk. And then also with those individuals, certain characteristics that put them at increased risk, such as age over 65 or someone with chronic conditions like diabetes, hypertension, kidney disease, that put them at increased risk for severe disease.
And also, just out of curiosity, do we have an idea or a sense of how many healthcare workers there are in Sacramento?
No, I don't have the number for Sacramento. I do know it for California, but I don't have the one for Sacramento right now.
Okay. So are you concerned about the logistics of rolling this out in terms of refrigeration and 2 doses and that sort of thing?
One thing that we're fortunate about in Sacramento is that we do have several major health facilities that do have the refrigeration capability, and we have plans in place. We've been practicing this before, and so it's a matter of being able to roll out our plans and making sure that we're all on the same page as far as where the vaccine is going and who's going to get it. But otherwise, in terms of being able to give the vaccination, I think we have a good plan in place.
Cool. So we're already ahead of a lot of places, I guess you could say, because of that.
Well, considering the information that we have, but definitely, and sometimes, of course, things do change, so we have to be prepared for that. But just to let people know that we do have a plan, and you know, we have a team that's working on this, and they've been working on it since the beginning of this pandemic.
Okay. Preparing for this moment. Can you tell me about, we've heard some information about turning testing sites into vaccine sites. Do we have anything like that in the plans?
We do. We have several ideas of where we can do the vaccinations. And so the testing sites do lend themselves well to that, partly because the communities already know where those testing sites are. We already have teams in those at those testing sites that we can easily provide training to be able to assist us with the vaccination portion.
Can you give me a sense of anywhere else other than those testing sites that might happen?
It's of course, we also have the drive-through. We are looking at either the Sleep Train Arena or the Cal Expo, and we've been using the Cal Expo for our drive-through testing, so we can turn that around. We're also working with the hospitals. They're going to be able to assist us, the clinics, emergency rooms, urgent care clinics. And so many of them are in the process of registering with the state database so that when the vaccine starts rolling in, they will be able to get a portion of that vaccine as well.
Okay. And my last question is really, how many healthcare I already asked that one. Never mind. I've already asked my question.
Yeah, I'll check. I know somebody has that number. I could check and email it to you if you don't.
I would appreciate it. And there's no rush on that, just before, you know, showtime, I guess I would say. By 4, let's say. I had one more thing that I just thought of. Oh, yeah. What would you say to people who might be concerned about safety at this point in time?
There are a lot of tests that are being done to ensure that these vaccines are safe. And I think it is of comfort, should be of comfort to people that the healthcare community is willing to be the first ones to get vaccinated. So that way people will be able to observe and see that they were able to get through it safely.
Yeah. And is there anything else that you want to say that I might not have thought about?
No, I think that's it for now. I'm sure we'll get more details within the next couple of weeks. So
yeah,
I'm
kind of interested when journalists will get it. Sometimes they call us frontline workers, sometimes not. I don't know if I would say that, but
well, you're somewhere in one of those priorities. I don't know which one, but definitely you are in one of the priority groups.
They call us essential workers, and now they have to prove it, I guess.
Exactly, and we depend on you to get the information out to the public. So